is just a huge, unbelievable honor to bring on Dr. Bradley Bale, MD, an adjunct professor at Texas Tech Health Science Center, medical director of the Heart Health Program at Grace Clinic, Lubbock, Texas, and runs a private practice in Gallatin, Tennessee. He's one of the nation's leading specialists in preventing heart attack, strokes, and diabetes. He co-founded the Bale Doneen Method with Amy Doneen in 2001. Their personalized approach of cardiovascular risk reduction has been effective enough to allow them to attach a guarantee to their clinical practices. The results of the method demonstrating regression and stabilization of arterial disease has been published in several peer-reviewed journals. So many dentists on Dental Town. Will you do a search, Ryan, on the app there, Dental Town, for his? What is the name of your book? I read it on.
Yeah, it's pretty simple. It's Beat the Heart Attack Gene. So we do a lot of genetic testing too. So it's Beat the Heart Attack Gene.
Heart attack, one word or two?
2 words. And
yeah, so I just did look at this. I did a search for Beat the Heart Attack Gene. That's where he learned about it. And your book's been mentioned by several guests on the show, but the look at this, the threads on your book go forever. And when I was reading your book, I thought, I'm going to try to get this guy on the show, and here you are. Thank you so much for talking to my homies today.
Well, Howard, thank you for the opportunity. You got a great show and a great following, so it's an honor to be on here with you. I appreciate you inviting me, man.
And your name, Dr. Bradley Bale, are you related to Christian Bale?
I sure hope so. He's great. Great actor.
Would you rather be associated with Christian Bale, the Batman, or Christian Bale, the American Psycho? Which one would you rather be?
I have to watch that American Psycho. It sounds like a good one from what you're telling me. I like Batman too, though.
Oh man, Batman was good, but I'll tell you, there's only 2 movies that my dentist homies can talk about all day long. It's Christian Bale's American Psycho and Fight Club, because both of those shows, the plot is so bizarre. I think most people think that the entire movie was all in their mentally ill mind and everything in the movie never happened. But I don't know. It's a crazy movie. But if you're ever sitting at dinner with 4 dentists and they all watch those 4 shows, they all have a different interpretation of the movie. Great movie. Wow. So talk to my homies. How can they prevent a heart attack? Is it predetermined? Most dentists will tell you how their dad and grandpa died and assume that they're going to follow the same path. Is that pretty close or not really?
No, not really. We believe they're all preventable, actually. And our method did evolve to the point 8 years ago that we started attaching a guarantee to our work. So if any of the patients we treat were to suffer a heart attack or ischemic stroke, we give them their money back.
Wow. How do you prevent the inevitable stroke?
Yeah, well, there's several types of strokes. The most common is ischemic stroke, and that one is the one that we will attach a guarantee to. Embolic strokes, and the ischemic strokes are about 85% of strokes. There are also hemorrhagic strokes, and they can occur from a weakness in the artery in the brain, an aneurysm, and we're certainly not going to guarantee that. And then the other kind is an embolic stroke. For example, a patient may develop atrial fibrillation. They'll form a clot in the heart, and it'll get pumped up to the brain and give them a stroke. And we don't guarantee that one either. But we do guarantee the ischemic stroke, which happens by the same mechanism as almost all heart attacks occur. And that's actually a blood clot will form and block the flow of blood, and that blood clot forms in a spot where the patient has cholesterol build up underneath, and then you get a break in the surface above it and you form a clot, and the clot's what obstructs the flow of blood. And we believe we can prevent virtually all of those.
I was really thrilled when I was reading your book out of nowhere. You mentioned I didn't even see a comment that gum disease was related to heart disease, and you mentioned dentistry and gum disease in your book.
Yes, actually, we just published a paper in the British Medical Journal stating that high-risk periodontal pathogens actually cause arterial disease. They're one of the many potential causes for disease in the artery, but it's the high-risk periodontal pathogens. So it's the pathogens that drive the arterial risk. It's not how deep the pockets are, how loose the teeth are, or how much bleeding the patient's having. So it's going to change dentistry, and that in addition to the exam for periodontal disease, we have to know the pathogens, and there's several good companies out there who can do DNA testing to tell us what pathogens are involved in the periodontal disease. And if they're any of the high risk, and we define 5 of the high risk pathogens, the PG, TF, TD, AA, and then FN. Those are the 5 that we name in our
paper. Say those again, PG, TF.
Yeah, TD, Treponema denticola, AA, which I'm not going to try to pronounce, and then FN. I can do that one, Fusobacterium nucleatum.
Fusobacterium nucleatum, PG, Pyomorphus gingivalis.
Yeah.
TF.
TF is Tannerilla forsythia.
And what's TD?
That's the Treponema denticola.
And give us your best shot at AA.
No, I'm not even going to try, man.
Oh my God, I'm not going to try AA either. Whether they want me to quit drinking or pronounce that bacteria, either one I'm not doing. So what % of heart attacks do you think are related to those 5 pathogens?
Well, it's hard to say what percentage of heart attacks are related, but the bottom line is knowing that they are a contributory cause of arterial disease demands that that be diagnosed and managed effectively, where you can eradicate the pathogens. And we have that in our paper. More research is needed on the dental side to tell us what are the best ways to get rid of those pathogens, what are the side effects of all that treatment, what's the cost of that treatment. But bottom line, knowing that it's causal demands that it be addressed and managed. So we like to call it a medical problem with a dental solution. We're not dentists. So we collaborate with our dental colleagues all the time in terms of diagnosing and making sure they manage well the high-risk periodontal pathogens. So if you want a simple example, one I use when I'm speaking a lot, it's kind of similar to driving under the influence, DUIs. They are a cause of automobile accidents. Nobody's going to argue that, right? They are. It's just like the high-risk periodontal pathogens are a cause of arterial disease. But there are other causes. So we all know people have automobile accidents all day long, and there is no DUI involved. And we also know occasionally somebody will luck out, right? They'll be driving under the influence and they won't have an accident. But knowing for sure that DUIs do cause automobile accidents demands that it be managed and addressed, just like knowing that high-risk periodontal pathogens cause arterial disease. It demands that the dental community make that diagnosis and apply effective management.
Man, I wish you'd write an article for that in Dental Town magazine. We go to 125,000 dentists in a monthly 100-page magazine, but now that it's online, we email it to that many more. But on Dental Town, people are sharing those articles. You can share them to your Facebook, Twitter, LinkedIn. So the digital magazine has twice the reach as the print magazine, but that would be an amazing article. By the way, I know everyone's driving to work right now, so I retweet my guest tweet. I'm at @HowardFran. You are at Bale Doneen, Bale, Doneen, Doneen. I retweeted your last 2 tweets. And by the way, man, you have 34,000 followers. My God, that you're serious as a heart attack. Your last tweet, Did you know that better sleep is literally a dream diet for weight loss and better heart health? And I retweeted NT Pro BNP, the happy heart test to predict heart attack and stroke risk. Your Twitter says you're out of Spokane, Washington.
Right. That's where our Bale Doneen Method LLC is housed, so to speak. And my partner, Amy Doneen, has a clinic there. That's where it all started. And Amy and I became partners in Spokane. And then I went to Texas. I got recruited to join a cardiology group in Texas. And Amy didn't want to go to Texas, which turned out to be a good thing because she kept the clinic going in Spokane, and she's done a wonderful job with that and has grown the clinic well. And she has patients from all over the world literally flying to Spokane to see her.
So if one of the dentists listening to you right now wanted to go get an evaluation, what cities could you see a dentist in?
Yeah, the best way to find that information is to go to our website, which is www.baledoneen.com, and we have a map on there of providers who've taken our course. We deliver a 2-day 17.5 CE and CME course where we train other healthcare providers, both dental and medical, and we have hygienists come to the course as well as dentists, and then of course medical providers. So that there's a map on there, and we need to beef up the medical providers, and we're working on that right now. There's a big group that's very well respected, and quite a few of them have taken our course and love our method, and we're trying to get their entire organization to embrace it, and that would certainly help solve the problem. Right now, there's a little bit of an issue with demand versus supply, because once people hear what we're talking about, a bunch of them want to be evaluated, because heart attacks and strokes, as you know, are still number one in terms of death and disability. Which
more
is
than cancer?
Yes, more than cancer. That's well documented. And they've been on the top of the billboard for death and disability for over 100 years, Howard. And that drives Amy and I crazy because we've had the technology and knowledge now for 2 decades to prevent the heart attacks and strokes. They don't deserve to be on the top of the list anymore. But as you know, it takes a long time to change the establishment, right?
Do you have a favorite in Phoenix?
Phoenix, there's some good people in Scottsdale.
Yeah, you got a lot of doctors there. Any of them off the top of your head that are your faves, or you got them in Scottsdale, Tempe? You have all over.
Yeah, no, they're good. Yeah, so I don't want to say on the podcast too much. We like them all, right? If they're embracing our method.
So let's get down to brass tacks. Obviously, if you just graduated from dental school last week and you're 25, you probably got other things to worry about than the heart attack gene. At what age, like I'm 54, what age do the dentists listening to you driving to work need to start getting serious about the heart attack gene?
Yeah, well, that's a great question. And I would say you want to couch that in your family history. Because if you have a family history of close relatives that have had heart attacks and strokes in their 40s or 50s, you would be wise to plug into our method really when you're a teenager, or even at the latest in your 20s. If there's no family history at all for heart attacks and strokes, it'd still be wise to get evaluated. And if you're a male, hopefully you'd want to do that in your 40s, and female, certainly by the time you're in your 50s, if there's no family history.
So if dentists are listening to you right now and they have no family history, what age would you say for a boy and a girl?
Yeah, with no family history, again, a male in their 40s and a female in their 50s.
So why would a male be in the 40s and a female in their 50s? Is it because the men make their life so nice and stress-free that they just live longer, and the men die earlier because we're so stressed out by the females? Is that basically what you're saying?
That's a great question. But we know historically that women have their heart attacks and their strokes about 10 years later in life than men. We know that. There are all sorts of hypotheses about why that is. So we don't know for sure scientifically exactly why they lag behind. Of course, a lot of people believe it does deal with the hormones, but nobody has really proven yet why.
You know, if I can say one thing about dentists, I mean, I don't have any data on this, but I have met and talked to a lot of dentists over the years. They don't like to take pills. I don't like to take pills. I mean, I only take one pill a day, and that's the thyroid and the thyroid medication. But a lot of dentists, they always hear that you're supposed to take that Bale aspirin. What is it? The 87 milligram daily aspirin. Are you big into the aspirin? Do you think taking a Bale aspirin every day is a good thing?
If you have disease in the wall of your artery, you have risk for a heart attack or stroke. So one of the things we do with every patient is assess for the presence of disease in the wall of the artery. And we can do that now painlessly, and it doesn't cost much. And that's the technology that's come around in the last 20 years to allow us to say we can prevent virtually all heart attacks and strokes. Prior to that technology, we had to wait for somebody to have a heart attack or stroke to know they had disease. But if we find a person has disease in the wall of their artery, what's going to obstruct the flow would be a blood clot. So in those patients, it is wise to take a little bit of anti-thrombotic therapy, and the easiest, safest way is with a low-dose aspirin. And if they didn't want to swallow a teeny tiny pill of aspirin, go get some willow bark and chew on it. That's where aspirin comes from, acetylsalicylic acid. So if they don't want to take pills, hey, just go get some willow bark and gnaw on it at least once a day. That'll work.
So what about statins? That's a huge controversy. I mean, it seems like everything. Well, first of all, the internet. I mean, my God, I'm only really an expert in like maybe one thing, and that's water fluoridation. And I would say 95% of all the information on the internet is completely insane information. Horrible sources. I mean, when people say they educate themselves on the internet, I just cringe. Same thing with statins. I mean, it seems like every time, half of them say yes, half of them say no. Where do you stand on statins?
Yeah, well, I think the problem with statins, they got their start by touting that cholesterol is what causes arterial disease and kind of the end-all, be-all for arterial disease, and that's absolutely incorrect. What causes arterial disease is inflammation of the artery, and cholesterol is one of many things that can drive inflammation. Another one that we've already talked about on your show today is the high-risk periodontal pathogens. Absolutely can cause inflammation of the arteries. So it's inflammation that causes arterial disease. It turns out that the statins, if you have to take a medication, are arguably one of the best, if not the best, medication to put out inflammation in the artery. We even have studies now that are published showing how statins reduce the inflammation caused by, guess what? Periodontal disease. So the issue with the statins, I think, revolves around the fact that everybody has couched the use of statins around cholesterol. We never have done that. For the last 20 years, the evidence has been there to state statins are one of the best medicines to put the fire out in the wall of the artery. It doesn't really matter what the cholesterol is in terms of how effective they are at that. And now they're going back into these big statin studies, and they're looking at markers of arterial inflammation. And guess what they're showing, Howard? They're showing it wasn't the change in cholesterol that drove the risk reduction. It was the change in the inflammation. But so we'll use statins, but we don't go by the guidelines where they basically state you need at least a moderate or high dose statin to get the job done. We frequently use doses that they don't even make. All we want is enough to put the fire out in the wall of the artery.
And how do you measure that inflammation? Is that the C-reactive protein or the super C-reactive protein?
Yeah, the C-reactive protein is the weakest of the whole bunch. It's really a wimp unless it's low. If it's real low, it can stand alone and tell you that the artery, the inside lining is okay. But if it's elevated, you could have stubbed your toe right before you went in to give the blood. So by itself, if it's elevated, it really doesn't mean much. The best marker for the inside lining of the artery, called the endothelium, is actually a urine test where we look to see how much albumin is getting into the urine. Because when that inside lining is inflamed in those tiny capillaries in the kidney, that albumin, which is a huge molecule, can slip through that inflamed lining and show up in the urine. If that lining is not inflamed, it's real tight. It can't get through, so you should hardly see any albumin in the urine. And that's like a $5 test. You just pee in a cup. You don't even have to give blood. And it's the best test for, in our opinion, the most important organ in the human body, which is the inside lining of the artery. The fancy term for it's the endothelium, but we refer to it as the tennis court because we all have about 60,000 miles of vessels in our body. Every one of them is lined by this single layer of cell called the endothelium. So if you took all those cells out of your body, Howard, you could cover easily 5 tennis courts.
Wow.
And you can only have a heart attack or ischemic stroke after that tennis court has to fail 2 times. The first failure is when it allows the bad stuff to seep through into the wall of the artery, like all the cholesterol stuff, because that is what forms plaque. Cholesterol is at the core of it, but it has to seep through. And then the second failure has to happen, and that's where that tennis court gets so inflamed that it cracks or breaks. And as soon as that happens, your body wants to put a scab on it, just like if you cut your skin. So you're immediately going to start forming a clot there. And that clot can become so big in a relatively short period of time, literally in seconds, it can totally obstruct the flow of blood to the heart or the brain. You're having a heart attack or stroke.
And that would be a stroke.
So that if it's in the brain, it's a stroke. Yeah, if it's so anyway.
If it's in the heart, what is it?
A heart attack.
Heart attack.
Yeah. So we have, that's the best test for the tennis court, but you also want to know, is it hot? Is it inflamed underneath the tennis court where that cholesterol collects and you build up what we call the plaque in the wall of the artery? Is it hot there? Well, we have a blood test for that. It's called lipoprotein-associated phospholipase A2, the plaque 2 test. And it's so good that the FDA approved it in December of 2015 to be run on all adults, whether or not you know they have disease, because it's such a predictor of heart attacks. So the plaque 2 tells us if it's hot in the wall. And then we have another test we nicknamed the Joker, myeloperoxidase, because this thing can inflame the tennis court. It can inflame it underneath the tennis court. And if it's elevated, all bets are off. It doesn't matter how great you're sleeping, whether or not you have periodontal disease, what your cholesterol is, your blood pressure. You want an ambulance outside with the engine running and a sober driver. That's how bad myeloperoxidase is. So we measure those tests routinely on our patients to make sure they're not going to have an event. All you have to do to keep them from having a heart attack or stroke is keep the artery cold. But one of the things that can fire it up is high-risk periodontal pathogens. So we're collaborating all the time with your dental colleagues because they have to take care of that. They have to diagnose it and take care of it. And then in terms of endodontic disease, it's possible that endodontic disease is triggering almost half of all the heart attacks. And the study
you have to write that article for Dental Town. Will you please write that article for Dental Town? Because I got a friend local who's a rhinologist, and a lot of times people are coming in for sinuses, and they're sticking scopes up there, and they've had a failing root canal for 20 years, and there's yeast infection all over the tooth. Same thing with implants. And the dentist, you know, he what's sacred to a dentist is the two elephant tusk teeth. So he wants to do a sinus lift and pack the sinus with cow bone and titanium and whatever the hell. And the ENTs are saying, will you stay out of my damn sinus and hook that bridge to those two elephant tusks? There is a lot of failing root canals, and hopefully this 3D imaging, this CBCT, but you just said a very powerful statement. If that was the title of your article, it'd be the most read article in dentistry in years. Failing, what did you say? Failing root canal, say it, repeat it.
Well, endodontic disease potentially is triggering around half of all the heart attacks. And that was a study that was published in Circulation, American Heart Association journal about 2 years ago by Dr. Pessi, P-E-S-S-I.
Can you find that?
And he took 101 people having a heart attack. So they're having a heart attack. So he goes in with his little scope and he finds the blood clot that's blocking the flow of blood. So he sucks it out. And he also sucks out arterial blood from a different part of the body. Then he analyzes those two samples with DNA for oral pathogens. He found the clots, 35% of them had the germs that cause periodontal disease. 76% of the clots had the germs that cause endodontic disease, the strep bug. And then he looked at 9 of the clots under electron microscope. All 9 of them, he found bits and pieces of oral pathogens. Then he randomly selected 30 of the 101 patients and did imaging of their teeth. Half of them had periapical abscesses. And if that was the case, their clot was 13 times more likely to contain that strep endodontic germ. So the basic conclusion in this paper, published in the American Heart Association, was a tremendous number of heart attacks are being triggered by endodontic disease. And the periapical abscesses that they found on imaging, no surprise, I'm sure, to you, most of them were in root canal teeth because, of course, the patient has no clue it's going on. They don't feel anything until they get their heart attack.
How do you spell Pessi?
P-E-S-S-I. If you want us to write an article for Dental Town, just nobody's ever invited us to.
Oh my God. If you wrote a deal that what you just said, that would send a lightning bolt through our industry. The rhinologist that I know thinks that equal percentages of people that you just said that were perio causes heart attacks is they think they have chronic allergies, or they say, you know, I didn't have allergies and where I used to live, and I moved to Phoenix, now I have allergies, because that's just the first thing they anchor to, and they don't realize they have a root canal that's draining into their sinus and failing for years and years and years.
Yeah, so one of the things we want from the dentist that we collaborate with, when the patient has any root canals, we want 3D cone beam imaging of that tooth. And we do have studies, I'm sure you're aware of them, that show that much greater accuracy of making the diagnosis with 3D cone beam than any other type of imaging, any other digital imaging even. So we want to get that. So if the dentist that they're seeing, of course, it's expensive equipment. So a lot of dentists don't have it in their office, but they always have a specialist they can refer.
I know, and those specialists, they're always sending the dentist cookies and treats on Valentine's and Christmas and Hanukkah and Passover, and the dentist doesn't realize that if you call up your periodontist or oral surgeon, say, "Can I send patients over to you? You charge them for the CBCT. You bill their insurance. A lot of the oral surgeons bill medical anyway, so a lot of the medical insurance covers it, and
Right.
you don't need $100,000 CBCT. Just
Right.
like when you go to your physician, he doesn't have an MRI. He
Right.
sends you to an imaging place, and they take an MRI or a CAT scan.
Exactly.
So, Ryan, was that you found it? So you found two articles: bacterial signatures
Yeah.
and thrombosis. Bacterial signatures and thrombosis aspirates of patients with myocardial infection by PESI
Right.
in 2013.
Oh, was that long ago? Oh my
And then
God.
the other one, let's see what the other one is. The other one, thanks, Ryan. Oh, wow.
2013. Oh my gosh. Time goes too fast.
So yeah, will you please write an article on this for Dental Town? And also, we have put up we started an online dental continuing education. We have 417 courses. They've been viewed almost 1 million times. If you've already got most all of our courses are an hour, but if you've already got 17 hours of content, one great marketing thing might be is to put an hour of it up on Dental Town, and then if they want to see the other 16 hours, they can go to your website or whatever, or you could put the whole thing up there. But this is so important because, I mean, so if you put an online CE course on Dental Town, it would be, and you'd sell a lot of books too.
No, we can do that. We actually have 3 hours worth of CE on a global platform now, so we could reach the hundreds of thousands of dentists around the world. And we priced it extremely low because we know a lot of these dentists probably don't have great incomes, and they can access those three easily by going to https://B as in Bravo, D as in Delta, .w like in women, C as in Charlie, E as in Echo, A as in Alpha, .education. So they can get three, but we can make some for you too if you want.
Well, if you already got the content, I would just put the same thing on Dental Town and it's just marketing. It's just different.
Yeah.
I mean,
Okay.
it's just a different market. But yeah, if you've already got that, I would put on I'd just put on Dental Town just so you build your brand with the people who need to know this the most.
Yeah. Okay. Well, great.
I do. I read your book on the airplane, and I got to tell you, it was a great name of that book because everybody sitting around me was asking me if it was a good book, if I thought it was informative, this and that. I mean, so it makes you realize that people know that this is as serious as a heart attack. I mean, they.
Yeah.
So why do you think everybody fears cancer more than heart disease? Have you noticed that?
Well, because probably we've gotten so good at treating the end stage disease like heart attacks. So you have a heart attack. Okay, big deal. They put a stent in, they bypass you, they give you a new heart, they give you an artificial heart. But people don't realize that their quality of life after that is never the same. And if you're having a heart attack you're not just going to get disease in the coronary arteries. You are going to be getting disease in the brain. Your risk of dementia is going to go up. Your kidneys are taking a hit. You're more likely to get kidney failure. If you're a man, this should be important, you're more likely to get erectile dysfunction because that's mainly arterial disease. And you certainly don't want amputations. So we know that our work keeps the arteries well throughout the whole human body. And we're very prejudiced and biased. We believe there's nothing more important for the maintenance of the quality of life for a human being than the highways that supply every cell in your body with nutrition and oxygen. So that's the work we do, is establishing and maintaining arterial wellness. And that's the most important thing you can do for a human. But cancer, we don't have you get end-stage disease now with a lot of cancers and they can't cure it. So that's probably why they fear it more. But heart attacks and strokes are number one. And dementia is rapidly growing. It's one of the fastest growing diseases, that and Alzheimer's. And my partner and I have talked about it. We can't think of anybody in the last 10 years who's developed dementia or Alzheimer's, because now they're publishing all sorts of studies, of course, showing that's highly related to arterial wellness.
And I think the worst part of our healthcare system is upside down. And so many people believe, well, if I get all this heart disease, I'll just go in there and get a stent or a bypass. And they don't realize that that's just the biggest part of the pipe. But there's the 60,000 miles of pipe has the same disease.
You got it.
But the doctors get $100,000 to do a bypass on the big kitchen sink pipe in the heart. And then the patient goes home and says, well, I'm glad I got a stent. Now I'm all good. And it's like, really? Well, what about the other 60,000 miles of pipe that wasn't replaced? And the doctors get this $100,000 reward for a 4-hour surgery. And I don't think that's the solution. Do you?
Yeah, well, the Chinese, in some regards, are way ahead of us, because they published in a medical textbook 2,200 years ago, they published, a superior healthcare provider prevents disease. A mediocre healthcare provider treats disease. And then an inferior healthcare provider treats the full-blown disaster that occurs from the disease. And our system was set up to reward the inferior healthcare providers more than the superior. The superior healthcare providers, arguably in medicine anyway, are like the pediatricians. Well, they're the lowest paid of all medical doctors.
Right.
So we've got it backwards, but it's going to take time and a lot of effort to flip it, right? It's not going to flip that overnight.
So say that again. The superior healthcare provider prevents disease. Is that how you started it?
Right, prevents disease. A mediocre healthcare provider treats disease before it's full blown, and then a inferior healthcare provider treats the full-blown disease. That's like, wait till you have a heart attack or stroke, and then we'll do some heroics and hopefully save you, give you a new heart, stent you, whatever. And our system was set up to reward the inferior healthcare providers much more than the superior or mediocre providers.
Yeah, and what's even more sad is the United States spends 17% of its GDP on healthcare and doesn't even cover tens of millions of people. It's the number one cause of personal bankruptcy. And then you go to the Taiwan system, which studied all the other systems, and they do it for $1,700 and have the same outcomes. You can only find their outcomes for their entire population for $1,700 a year if it's the same outcomes for Mayo Clinic and Cleveland Clinic.
Yeah. Wow.
Not Beaumont, Texas, and Parsons, Kansas. I mean, it's just, and then when you tell that to an American, they start thinking you're a socialist, communist, crazy man, and you're like,
No,
dude, everyone in your family, it's just you can't rationalize with someone who doesn't open up their mind. You say, well, does your grandma want to quit Medicare? I thought your grandma likes Medicare. Oh, she loves Medicare. Well, why don't you do that for the whole country as $1,700 a year? It's just a base. If you don't want it, you don't have to have it, but you could cover everyone for seven. What do you think of the Taiwan model, or what do you think of that?
I'm not familiar with the Taiwan model in detail, but I do know it's much more cost efficient to prevent disease than it is to treat the full blown.
Well, what the Taiwan model was after World War II, a bunch of after World War II in the Reconstruction, they said we can't rebuild a society if everybody's sick and stupid. So let's really put a lot of money into national health insurance and education. And Churchill was preaching that message, and 20 countries did it. Well, they all did it differently, and any businessman knows the devil's in the details. It's all in the very, very details. Well, Taiwan was the last country to come on board, and they just did it 10 years ago. So they studied all the details, and they said the only thing they learned from America is what not to do. And then they took the best parts of Canada, Australia, New Zealand, Britain, all those countries, and they designed a system, and basically you can only find outcomes that high on Mayo Clinic patients.
Yeah, well, that's wonderful.
Sounds but there's no chance. There is no chance Americans would do that.
But yeah, my partner and I, you can imagine, we stay very passionate about what we specialize in for numerous reasons. Again, heart attack, stroke are still at the top of the billboard for death and disability. They have been for 100 years. They don't deserve to be. We have the technology and knowledge now to take them off the top. And then from the financial aspect, cardiovascular disease is the number one healthcare cost. It's cardiovascular disease. So maintaining the wellness of the artery could potentially save this country hundreds of billions of dollars every year in healthcare costs. Hundreds of billions.
Right, but the lobbyists don't care. They just want to sell stents, and I mean
we're making progress. Well, you may want to join us. We have our Bale Doneen Method reunion where providers who've taken our course, we all get together once a year. And this year we're having it in New Orleans, November 3rd and 4th. And we've already arranged with the city of New Orleans to have our own parade. So we're going to have the Bale Doneen Method parade through the French Quarter. We're going to end it in the cemetery. We're going to do a memorial for all the people buried there due to cardiovascular disease, and pledge to keep going until we take this off the list as the number one cause of death, disability, and the highest financial burden this country has. It's going to be fun. You should come down there and march with us, Howard.
Yeah, I might. Email me those details right now. So to find a doctor that does your method, you go to Bale Doneen. Say it in Ryan where you can find it. Just you don't have to spell letters. Tell Ryan where you can find those on your 3-hour online C course. That's the https://B as in Bravo, D as in Delta,
W like in women, C as in Charlie, E as in Echo, A as in Alpha, .education.
And my homies, if they want somebody who does the Dale Doneen method, they go to Bale, like Bale Hay, Doneen with a D, DONEEN.com. And then those 3 horizontal slashes, that's means menu. And one of the menus is find a provider. And now you got a map. How much, now when you go to those providers, do you take Medicare insurance? Is it cash? How much does it cost? How long does it take? Do you need to not eat the night before, fast? What do you need to do?
Yeah, well, we don't dictate to these providers exactly how they run their business. So some of them take insurance, some of them don't take insurance, some of them do a combination of insurance plus an additional fee. The bottom line, to deliver this type of care, it takes some time. You know, a physician can't walk in the room for 15 minutes and get the job done. So there has to be proper reimbursement to make it work, and everybody figures that out a little bit differently. So you'd want to just contact the provider and talk to them about those details, because we don't have like a franchise. So these
Yeah, you have one in Tempe, you have one in Mesa, you got like a dozen in Scottsdale, but I'm surprised you don't have one in Ahwatukee. That's where I live.
Well, when you get one, you
What's
know a
that?
medical provider there, give them a book if they're interested, and they come to our
You know,
course.
I was going to give my book to my physician that I've used forever, and I left it. After I read it, I finished it. I put it in the back seat cover in front, and then I left it on the airplane.
Oh no, well, you need
And
to
you,
get
and
it.
you know who sent me a copy of that book?
What's that?
You know who sent me a copy of that book?
No.
Bruce
Who?
Baird.
Oh yeah, I know Bruce real well.
Yeah.
Yeah, we're really actually looking to work with Bruce quite a bit. He's a great guy. Yeah,
He
he's
is
a
a
good
great guy, and he's always been a pioneer. I mean, he was the first dentist I ever met that built an office that collected $4 million a year. I mean, he's just
yeah.
an amazing man. He's got so much energy.
Yeah,
And
he's been to our course. He's been to our 2-day course, and I think he's planning to come to the next one in Seattle. It's October 6th and 7th, but about half the audience are on the dental side, about half are on the medical side. And if anybody listening wants to get in depth with our method, that 2-day course is the way to do it. If a dentist and a medical provider from the same community attend the course at the same time, hey, away you go. Everybody's speaking the same language. You can refer back and forth and keep the people in your community well from an arterial standpoint.
if you want to read his book, it's on Amazon.com. It's called "Beat the Heart Attack Gene: The Revolutionary Plan to Prevent Heart Disease, Stroke, and Diabetes." He has 102 5-star reviews. That is just incredible. I only have 50 on mine. I must have wrote about the wrong subject, business. But I read the book. It's a great book. Like I say, you talked about gum disease. You had a checklist. I mean, it's just something that if you have grandchildren, you got to start getting serious about this stuff. I mean, you know, you want to see her graduate from high school, and it's just amazing. What else do you think the dentist listening to you should know or do?
Yeah, I think if they read the book, that should pique their interest to
They
want
should
to.
read the book, and then they should go to Bale Doneen and find a physician in their area that basically you've certified him, or they read your book, or what is
Yeah,
these like?
great comment, great question. We're working on a certification process right now, but it's not there. So all it denotes at this point in time is they took the 2-day course. They're familiar with the method, exactly how they're applying it. We don't know in every case. We do have some people that have purchased what we call our toolkit. Well, we know really well that they are definitely doing a great job, but we need to grow that from the medical standpoint.
Yeah, I want to live because, you know, I'm single, so I'm enjoying life. I know a lot of my friends are married, and that's the only thing that keeps them going is they just think one night they're going to reach in that refrigerator for a hunk of cheese and a beer and fall over dead of a heart attack. But, you know, I'm single and got 2 grandkids, so I actually want to live.
Yeah, well, if you're single, you want the arteries throughout your body to stay well, right?
Yeah, and the American healthcare system, like you say, it's a broken system that treats disease. And how many, I mean, everybody in the world has a grandma that says, I can't believe it. He had a physical last month and doctor said he's all good. Then he dropped dead of a heart attack. How many times have you heard that in your life?
Oh, yeah. No, that's what started me down the path over 20 years ago. from my family practice, because I would have that happen with my patients. I'd send them to the cardiologist, they put them on a treadmill. So, oh, they're fine. A week later, they're in there having a heart attack. I said, something's missing here.
Yeah.
And the fact is, we love cardiologists and they do an excellent job, but they're trained in treating that end stage disease. They don't have the training in prevention.
Do you find the doctors open-minded about prevention, or do you find them not resisting change, or do you find them just insurance-driven and just trying to make a living and just drilling after what's ever billable to Medicaid and Medicare? What's your assessment of your MD colleagues?
Yeah, that's an excellent question, and really, I think to some degree, all of your comments can apply. It depends on the individual person. Certainly, we have more and more cardiologists that get excited about what we're doing and get on board. My partner down in Texas at my clinic's a great cardiologist, and my partner in Spokane, Amy Doneen, her most recent partner is a cardiologist, a quite renowned cardiologist out of Spokane. So you find that happens, they get excited about it, they want, and then there are others that say, hey, look, that's not what I'm trained in. I'm good at putting in stents, and leave me alone. That's really all I want to do. And there's certainly a need for that right now, right? But there's like, hey, I'm so busy putting out fires, I haven't got time to prevent them.
And that's how dentistry was. I remember the first guy that was going around talking about dental hygiene to prevent disease. Almost every dentist listened to him say, I am so busy pulling teeth, doing dentures, I don't got time for this prevention bullshit. You know,
Right.
and it was amazing. He actually went down in an airplane, but he was the guy going around telling everybody, I know you're busy. I know you're busy pulling teeth and doing denture, but can't we just put a chair over here so that maybe the next generation doesn't have to have wooden teeth?
Yeah, what's the exciting thing is it's moving that direction now, Howard. I mean, more and more publications, and we have several of them out there, clearly demonstrate the science is available now to establish and maintain the wellness of the arteries. And when you do that, again, you don't have heart attacks, you don't have strokes, you don't get dementia, you don't get erectile dysfunction, you don't lose your kidneys, you don't need amputations. I mean, that's like, hey.
Now, I think you just did a HIPAA violation by reading my health record in front of everybody live on my podcast. You just read my entire health history. Speak to that. What if some homie's listening to you and it says, you know, I give up. I did everything wrong. I'm 65. Is any of this, if someone had done everything wrong and was 65, is any of this irreversible? Does any of this clean up, or you kind of, I mean, you can't go to a burned down house and say, oh, we'll put a fresh layer of paint on this.
Yeah, no, you can absolutely, it doesn't matter what the age is. We have patients in their 90s. I believe Amy has a patient in their hundreds. So, yeah, no, you can stop activity in the wall of the artery at any age.
And then that would, so no matter how bad it was and no matter how old you were, you can make it better and extend your life?
Oh, absolutely. Yeah.
See that, Ryan? You got hope, buddy. Ryan's 24. He's already thrown in the towel.
No, I mean, it's really exciting, though, Howard. We live in an exciting age, and one of the publications we have that was in a peer-reviewed journal states the title is, We Now Live in an Era Where You Can Guarantee Arterial Wellness. Now, how exciting is that?
It's amazing how smart you can be and still be humbled by this self-experience. We had a President Bill Clinton who had a bypass, and he literally thought he got it fixed and was all good. And then within 10 years, he was back for another one. And he's a lawyer, was the president. He studied the hell out of it. But one of the things he did, I want you to touch on his diet. He changed to vegan. Do you think? I'm sure all fat people like me want to know the most. How am I going to have to change my diet?
We base dietary advice on genetics. So there are individuals, if their ApoE4 gene and their heptoglobin 1, where a vegan diet could be wonderful. But if they're ApoE2 and they've got haptoglobin 2 gene, it wouldn't be the best diet for them. So it depends on the genetics. We personalize our care with each individual patient through the use of genetics. And that menu, of course, just keeps expanding. But there'll never be a one-size-fits-all diet. It's not going to happen because we're all genetically different. So when you carry ApoE4 gene, you need a low-fat diet. Well, vegan diet, man, that can be a great diet potentially for that.
I've been
But if
100% vegan.
You need fat.
I'm 100% vegan my entire life. I only eat animals that only eat grass.
Yeah, right.
You know, I will not eat a cow unless it eats grass. So what about obviously obesity, belly fat around your waist? How do you recommend getting? What is the best way to get rid of belly fat, and how big of a factor is that to inflamed arteries and the heart attack, Gene?
Yeah, it certainly can be a significant contributor, but one of our colleagues and a fan of our method, actually, Dr. Chip Levy, Liev, who is a cardiologist out of the Ochsner Clinic down in New Orleans, he's published the book, The Obesity Paradox. And there is a paradox with obesity, but the bottom line that I want to get across from his work is what trumps fat is fit. So somebody can be overweight and even obese, but if they're physically fit, it greatly mitigates the potential harm from that obesity. It doesn't totally, but it can make a huge dent in it. So you can take somebody who's thin, who's not fat at all, looks on the surface in great shape, and if they're not fit, their risk for a heart attack or stroke is going to be much greater than the one who's overweight and fit. So fitness, exercise, lifestyle is the number one way to beat the heart attack, stroke, dementia risk. To keep the arteries well, we need a good lifestyle. And absolutely a critical element of that is to be physically active. Now, we don't require patients, of course, to go out and run marathons or anything, but we want them all to get no less than 22 minutes of the equivalent of a brisk walk every day. So it's not like it, and do some resistive training twice a week. But fitness does trump fat. Okay.
So that guy that you talked about, write that book, is he a friend of yours?
Yes, he's an excellent cardiologist.
You know, it's so sad. So many of the greatest legends in dentistry, they're gone and they didn't leave.
Yeah.
They just lectured, and there's no digital, there's no thing in YouTube. They're just gone. I've already have a couple of podcasts. They're gone now. Bruce, Bob Ibsen, founder of DenMat, Carl Misch, one of the greatest implantologists in the world, if not the greatest, and Bruce Barkley. I think it was Bruce Barkley. Let me see if that's right.
Did you ever? Yeah. Did you ever have Kai on? Did you ever have Kai's on?
No.
Yeah, he was a legend. I mean, he was a pioneer with those periodontal pathogens. Yeah.
Yeah, 30. Yeah, Bob Barkley. And you kind of remind me of, you are Bob Barkley. Bob Barkley, a 30-year memorial to Bob Barkley and his paradigm-busting work in preventive dentistry, participating. He was flying around the world, and he went down an airplane in 1977 at age 46 in a tragic small plane crash in West Central Illinois. And but he was the guy. Really, he was the guy. Obviously, every great person stands on the shoulders of a lot of great people that went before him. But he was the guy going around trying to get all these dentists pulling teeth all day and making dentures that, okay, please consider this hygiene department. And now you're the guy running around saying, I know you can get a stent. I know you can get a bypass on that one little big pipe in your heart. Even if you get a quadruple bypass, you still got 60,000 miles of pipe that ain't going to get a stent. And you're the guy going around saying, I know you can get a $100,000 bypass and Medicare and Medicaid to pay for it, but I really don't know. You really should try to prevent getting that instead of
Absolutely.
looking forward to it.
Yeah, and you can. With the right information, you absolutely can, again, establish
I seriously look
maintain
forward to a bypass because I assume it comes with a 6-week vacation. I mean, I just want to have 6 weeks off. If it takes a bypass to get that, I would do it. But yeah, so kudos to you. I can't believe we talked for an hour. We're 3 minutes overtime. I could talk to you all day. Also, email me. I need to get you to speak at our annual county meeting. We've had an annual meeting every year for 15 years in Vegas. But you know, there's a lifestyle change. We actually changed the meeting from Vegas to Orlando because now I got 2 grandkids and they don't want to go drinking in Vegas and gambling. They want to see Mickey Mouse, and I think
got grandchildren too. I may have to bring them along if you invite me down there.
Oh yeah, they. I swear they. What's that one Disney movie that Taylor's watched 15 times? Frozen. I mean, my God, she could watch that 100. It's weird how those little kids will watch the same Disney movie 100 times.
Oh yeah.
But yeah, give me your boy from Louisiana on the diet book. Give me your partner in crime. We'll go back to back, and we'll try to really try to promote you in getting physicians, dentists to start understanding the oral systemic link between these 5 bacteria found in periodontal disease that are causing a third or associated with a third of the heart attacks. But more importantly, starting to realize that when you have a root canal, you take out the early warning nerve system that there's a problem, and these draining chronic root canals are turning out to be a disaster. And I almost think that every person over 50 who has a bunch of endos should be referred to an endodontist with a CBCT and just ask the endodontist, are these all good? Because some of those need to be removed and replaced with an implant or something.
No, absolutely. Yeah, I agree.
And everybody listening who's looking for speakers at their state meeting, please start asking around your rhinologist and ear, nose, and throats, because anytime you meet one and you tell them you're a dentist, you're going to get your ass chewed for about 30 minutes. And because they see this also, that oral systemic link, dentists don't run around with rhinologists. Rhinologists don't speak at study clubs. And this oral systemic link means we're going to have to get connected to the entire value chain of healthcare.
Absolutely. No, you're a critical element in the wellness of a human being for sure. We always state good health starts with a healthy mouth. That's where it all starts. So we really don't even quite understand why is there dentistry and there's medicine. We're all healthcare providers. And we really love the hygienists. They don't get enough credit for what they do. They're the ones treating that periodontal disease.
Yeah, they're the ones that...
So we love hygienists as well as the dentists. And we also love the dentist's office staff, because you have to have the whole team in place for this oral systemic connection. You know, you don't want the patient leaving after having, say, a salivary DNA test for the periodontal pathogens. They're leaving the office and the little receptionist says, "Oh, they're doing that test on you too, huh?" You know, you want them saying, "Wow, are you lucky? You're going to find out what germs you have in there, because that's what drives the risk for heart attack and stroke. Lucky you came in here." That's what you want that office staff saying. So you need the whole team on board. Absolutely. It can't just be the dentist. I know I'm talking to dentists. I don't want to piss them off. But if they don't have a proper team in place, they're going to be dead in the water. I don't care how much they know. Does that make sense?
It makes total sense. And I think this oral systemic link is it's starting to take off. There was a lot of skepticism, and that's good. It's always good to be a skeptic, especially in a time when fake news and all that stuff. But the evidence is starting to get massively overwhelming, and I look forward to you putting a 3-hour online C-course on Dental Town, and maybe, because that's really changed continuing education. You don't have to fly across the country and go sit in a building. You can just pull it up on your iPhone and then throw it up on your Apple TV and sit there in your living room drinking a beer, smoking while watching this video on online on how to prevent cardiovascular disease.
Talking to an artery guy. Hopefully not smoking out.
They're gonna smoke and drink Bud Light while they watch your 3-hour video on how to prevent a heart attack. Okay, thank you so much today for coming on the show. I just think you're amazing, and thanks. Shout out to Bruce Beard, who was talking on this show earlier that everybody should read your book, and look forward to doing a lot with you.
Well, Howard, you're going to help save hundreds of thousands of lives, man. Karma's going to be on your side.
All right, well, all right, buddy. Thanks for all you do.
It's fun. Okay.
I'd rather talk to you than Christian Bale any day.
I don't know about that, but okay.